Hello and welcome to this lesson, cholelithiasis or gallstone. So first, let's understand what are the types of stone that we can have inside our biliary system and gallbladder. So we can have three main types of stones. We can have cholesterol stones, we can also have pigmented bilirubin stones, and also we can have the mixed type of stone. So the cholesterol stone is the most common type of stone that can happen, and also the most common type of stone being found in cholelithiasis. And these type of cholesterol stones consist of cholesterols, and they are yellow in color. So we have several risk factors. So anything that causes hypercholesterolemia or elevated amount of estrogen is associated with creation of cholesterol stones. So the female gender is one of the most common risk factors that the patients can have. Also obesity and pregnancy. Remember that pregnancy is associated with elevated amount of estrogen. Oral contraceptives are also associated with elevated amount of estrogen, and also hormone replacement therapy. So another type, the second type that we are going to talk about here, is pigmented bilirubin stone, and this stone is actually consists of calcium salts and unconjugated bilirubin. So the risk factors for creation of pigmented stones in biliary system is any pathology that causes unconjugated bilirubin and calcium salts. So for example, the patient can have hemolytic anemia. So hemolytic anemia is associated with elevation of unconjugated bilirubin. Also in case of liver cirrhosis, because of the fact that liver is not capable of converting unconjugated bilirubin to conjugated bilirubin, we are going to end up with unconjugated bilirubin. Also bacterial infections and parasites like ascaris. So these stones are actually usually in black, and they are going to be seen in black color. So the third type is the mixed stone, which is a combination of cholesterol stone, bilirubin, and calcium salts and other compounds. And these stones are actually varying in color and composition, and usually the bacterial infections are more associated with creation of these type of stones. So here in this picture, you can see the three types of gallstones. We have cholesterol stones that are usually in yellow color. We have pigmented stones, which are usually in black color. And in case of mixed stones, we have different types and different color variety in case of mixed stones. So here in this picture, you can see formation of different types of stone. Always remember that we have a balance in production of cholesterol and production of bile salts in our biliary system. So when this balance is broken, we are going to form the different types of stones. So the first one is when we have elevated amount of cholesterol in our biliary system, we have elevation in cholesterol. So the extra cholesterol is going to react with the calcium inside the biliary system, and as the result, we are going to form the cholesterol stones. If the balance is broken in favor of the unconjugated bilirubin, and we have elevation of unconjugated bilirubin in our biliary system, for example, in this case, due to hemolysis, the excess amount of unconjugated bilirubin is going to react with the calcium inside the biliary system, and as the result, we have black pigmented stones in our gallbladder and in our biliary system. And mechanism of the mixed type brown pigmented stones is something in between, and as you can see, this is due to the fact that we have biliary infection or infestations of the bacteria inside our biliary system. So what are the risk factors for cholelithiasis? We have famous 4F: female, fat, 40, and fertile. So increased age is having increased risk for cholelithiasis. Genetic factors: people who are having family history are at increased risk for cholelithiasis. Also ethnicity: people who are Native Americans or Hispanics are at increased risk for cholelithiasis. Also increased estrogen. So pregnancy, in case of pregnancy, we have increased amount of estrogen, and also patients who are taking oral contraceptives, because of the fact that these drugs have estrogen compound in them, they are at increased risk for cholelithiasis. Obesity is another risk factor, because in case of obesity we have increased cholesterol in our body and we have increased saturation of cholesterol inside our biliary system and inside our bile, so this increases the risk of cholesterol gallstones. Also rapid weight loss, because of the fact that in case of rapid weight loss we have increased mobilization of the cholesterol in our body. This causes biliary stasis and also increases the risk for cholesterol bile stones. Also other conditions, for example diabetes, liver cirrhosis and Crohn's disease, increases the risk for cholelithiasis. So what is pathophysiology involved in case of gallstone? First of all, the bile composition, as we talked before, the imbalance between production of the cholesterol, bile salts and lecithin leads to formation of gallstones due to increased bilirubin or increased cholesterol. So extra cholesterol or extra bilirubin forms a stone. Another risk factor, another point behind the formation of the gallstones is the gallbladder motility. If the gallbladder has hypomotility or incomplete emptying of the bile to the biliary system, causes a stasis of the bile and promotes the formation of the stones. Another point behind the formation of gallstones is mucus secretion, because increased mucus secretion in the gallbladder traps the cholesterol crystals and promotes the formation of the gallstones. So what are the signs and symptoms of cholelithiasis? First of all, note that until the stone is not getting stuck somewhere in the biliary system, we are not going to have any symptoms in case of cholelithiasis. So as the result, most patients are asymptomatic and discovered incidentally on the routine examination. For example, if the patient is having ultrasound for another reason, we can see the stone in the gallbladder. So again, we are not going to have any symptoms until the stone is getting stuck somewhere. So if the stone is getting stuck somewhere, the main symptom is going to be pain, and this pain is going to show itself in the right upper quadrant region and in the epigastric region sometimes, and the pain can also radiate to the shoulder and back of the patient. And the pain is typically going to come after eating fatty food. Why? Because one of the stimulators of contraction of the gallbladder and sending the bile from gallbladder to the biliary system is the enzyme cholecystokinin, and when we are eating fatty food, the cholecystokinin level is going to go up. As the result, we have contraction of gallbladder muscles, and as a result, the stone can getting stuck somewhere, and as a result, we can have pain. Another symptom that we can have is nausea and also vomiting, and Boas sign is going to be also positive in this group of patients. So what are the complications of cholelithiasis? In order to understand the complication of cholelithiasis, we have to know the different parts of biliary system. So as you can see, we have intrahepatic bile ducts. They are responsible for transferring the bile from the liver to the gallbladder. Here we have the gallbladder. We have common bile duct. This is the pancreatic bile duct, and this is the rest of gastrointestinal tract, duodenum. So the first complication is cholecystitis. Cholecystitis is inflammation of gallbladder itself, and this is usually happening due to obstructed the cystic duct. So the second complication is cholelithiasis, and this is when we have gallstone in the common bile duct, which can lead to obstructive jaundice because the bile flow is obstructed by the stone. Also, we can have cholangitis and also pancreatitis. So another complication, the third complication, is cholangitis, which is inflammation of the biliary system and bile ducts, and this is usually presenting itself with Charcot triads. Charcot triads is three symptoms. We have fever, we have jaundice, obstructive jaundice, and also we have right upper quadrant pain. And also the fourth complication is gallstone pancreatitis, and this is usually happening because of the fact that the stone is going to getting stuck in the pancreatic duct, and this obstructs the pancreatic flow, and in the pancreatic juice we have enzymes that are lytic enzymes. So as the result, the pancreatic enzymes are going to be activated inside the pancreas, and as the result we can have inflammation of pancreas and gallstone pancreatitis. So what are the diagnostic tools that we can use in case of cholelithiasis? First of all, note that in uncomplicated cases of cholelithiasis, we are going to have normal liver function test. But if the disease is complicated with cholelithiasis or cholecystitis, because of the fact that these two entities causing obstruction to the biliary flow, we are going to have elevated liver enzymes in the blood. So another test that we can use, and it is specific for gallstone pancreatitis, is measuring the amount of amylase and lipase enzymes in the blood, and they are going to be elevated 3 times more than normal. Another test that we can use is in case of cholecystitis and cholangitis, we can do complete blood count, and because of the fact that these two entities are inflammatory entities, we are going to have elevated white blood cells in the blood. But the imaging test that can detect the gallstone is ultrasound, and this is the first line imaging that we are going to use in case of cholelithiasis. It can detect the stones that are as small as 2 millimeters, and also it can detect the gallbladder, the thickening of the gallbladder in the imaging. So here in this picture you can see an ultrasound. As you can see, the walls of the gallbladder are thickened, and also you can see stones inside the gallbladder. CT scan is not sensitive, but it can be used in complicated cases of cholelithiasis. And the last imaging tool that we are going to discuss here is MRCP. MRCP is standing for magnetic resonance cholangiopancreatography. This is a non-invasive imaging test, and it is assessing the biliary tree, and it can be used if we have cholelithiasis. Now, what are the treatments for cholelithiasis? If the patient is asymptomatic, we do not need to do anything, and usually treatment is reserved for cases that are having risk of complications. For example, if patient is having very large stone, or the patient is in danger of hemolytic anemia. But if the patient is symptomatic, the surgical choice is cholecystectomy. This is surgical removal of the gallbladder, and we have 2 methods for doing cholecystectomy. We have laparoscopic cholecystectomy, which is the gold standard. This is a minimally invasive surgery, and it has a very good prognosis and very fast recovery. Another surgical option for cholecystectomy is open cholecystectomy, and this is usually reserved for patients who are having contraindication for laparoscopic cholecystectomy. We also have non-surgical options for cholelithiasis, but this is usually rarely done, and it is done when the patient is not a good candidate for the surgery. So in this case, for example, if the patient has suffered recently from myocardial infarction, we can use ursodeoxycholic acid in order to dissolve the cholesterol stones. And also we should have the pain management in this group of patients, because they are going to have a very severe pain in right upper quadrant and epigastric region, and drug of choice here is from the group of NSAIDs, and ketorolac is the drug that is usually used in this case. Also, we have management for complications of cholelithiasis. For example, for acute cholecystitis, we should give the patient first antibiotics. For example, ceftriaxone and metronidazole are 2 of the antibiotics that are used in this case. And after that, the patient, if the patient is stable, should do cholecystectomy. If the patient has cholelithiasis, ERCP is the management of the choice, and by ERCP we can do removal of the stone, and after that we can also do cholecystectomy. For gallstone pancreatitis, the supportive management is favorable, and usually we can do removal of the stone with the ERCP if it is necessary. So in case of cholangitis, the management is ERCP, antibiotics, and also supportive care. And also note that cholangitis is a medical emergency. Now, what are the recaps? First of all, know the types of gallstones for your board examination. Remember that we have three main types of gallstones. We have cholesterol gallstones, the yellow stones, we have black pigmented stones, and also we have brown pigmented stones, and also know the associated risk factor for every single one of these stones. Also, another point about this disease is that the patient is going to have biliary colic. This is a characteristic pain pattern, and it is usually coming with fatty meal and after fatty meal. And also note the difference between symptomatic and asymptomatic gallstone, and also the managements. Also, the complications are very important for the board examination, so you have to be able to make a differentiation between cholecystitis, cholelithiasis, cholangitis, and also gallstone pancreatitis. Also know the management for the cholelithiasis. Know that we have two types of surgery. We have laparoscopic cholecystectomy, and also we have open cholecystectomy, which is the definitive management. And also ERCP can play a role if we have complication of cholelithiasis. Thank you for watching.